Hi everyone! Today, I'm going to answer all the questions about orthokeratology. So, if you want clear vision without eyeglasses or surgery, this video is for you. Orthokeratology is a non-surgical way to achieve clear vision. So how do we achieve that? We just use a small transparent lens called an Ortho-K lens. We put it on your eye while sleeping, and then it gently changes the shape of your cornea so that when you wake up in the morning and remove the lens, you will achieve clear vision without any eyeglasses or surgery.
So I decided to opt to have an Ortho-K. Overnight ko lang siya ginasuot. Pagising ko sa morning, magic 20/20 vision. Ortho-K is very nice for me. Very helpful.
Bumabalik ba yung grade after mo mag-orthokeratology? As long as ginagamit mo yung Ortho-K lens mo or molds mo every night, hindi babalik ang grade mo. Yes, you can use orthokeratology to correct astigmatisms. However, sa traditional na orthokeratology, you can only correct -200 na astigmatism or lower. This is why we have our own 𝗗RA, which is an advanced accelerated orthokeratology method that can help correct patients that have -200 astigmatism or higher. We have a lot of patients that have very high astigmatism that achieve successful visual outcomes with their orthokeratology. With traditional orthokeratology, -600 lang na nearsightedness or myopia ang maximum na kayang i-correct. But with 𝗗RA Advanced Accelerated Orthokeratology, we can correct very high eye grades kahit na more than -10.00 or 1,000. Traditional orthokeratology can only correct nearsightedness or myopia na -600 or below, astigmatism na -200 or below, and it cannot be used for patients who are farsighted or hyperopic. Anong ibig sabihin nun? If you have blurring of vision sa malayo, pwede kang mag-traditional Ortho-K. Pero kapag meron kang blurring of vision sa malapit because you have hyperopia or farsightedness, you cannot have the traditional Ortho-K method. What you need is 𝗗RA Advanced Accelerated Orthokeratology that can only be availed here at Eyecare Deluxe. Orthokeratology is the best correction for people who love the water, people who love to swim, people who love water polo, or who just likes to surf and go to the beach. Sobrang gusto nila yung orthokeratology. Why? Because orthokeratology helps correct your vision without glasses, without surgery. Imagine your eyes the way it is right now, but with clear vision. So, you can go in the water, you can swim, not only swim and go in the water, you can even do contact sports like boxing, basketball, and all those other activities that you will need to avoid if you underwent an eye surgery. That is why orthokeratology, for me, is the best and safest vision correction. You know what? I'm not only in Davao, I'm also in Manila. I travel between Davao and Manila 50% of the time. So, 50% of my clinic days are in Davao and 50% of my clinic days are in Manila. And on those other days when I'm not around, there are also associate ophthalmologists and optometrists ready to assist you in the clinics. I'm only speaking in my experience. I have a very wide range of patients who use orthokeratology. My youngest patient is 3 years old, and my oldest patient is actually in her 80s. Orthokeratology is perfectly safe for all ages. As long as you can use these lenses regularly every night, you can safely wear Orthokeratology. Sino lang ang hindi pwedeng mag-Orthokeratology? Of course, patients who have keratoconus or corneal disease, patients who have herpes, meron silang viral disease sa kanilang cornea. Pregnant women are not allowed to undergo orthokeratology, not because it's not safe for them, but because their eyes will constantly change as they go through their pregnancy. That's why we advise them to wait for a year after giving birth before being fitted with the orthokeratology lenses. Basically, these orthokeratology lenses are perfectly safe for everyone, for all ages.